Chairman, I can confirm we're now live.
Thank you. And good afternoon. I'd like to welcome everyone to this public virtual meeting of the Local Outbreak Engagement Board. Just for everyone to note that the meeting is being broadcast and recorded. Item 1 on the agenda is, do we have any apologies for absence?
Chair, I've received apologies from Councillor Bettison.
That's fine. Is anyone aware of any other absences? If not, we shall proceed.
Chair, any other board members who've not provided apologies and who do not arrive at the meeting will be recorded as providing their apologies. Great,
thank you. Item 2 is a standard item on declarations of interest. Does any member have any interest to declare, either disclosable, pecuniary or affected today? No, that's great. Thank you very much. And just moving on to the next agenda item. Sorry, my laptop has just decided to have a... Item 3, is there any items of business, urgent items of business to discuss?
Chair, I'm not aware of any urgent items of business.
Thank you. Item 4 is to review the current data that relates to COVID-19 infection rates nationally and within the borough. Charlotte, over to you.
Thank you, Chair. I'll share my screen. Bear with me. Is everybody able to see the screen?
Yeah.
Yeah.
Okay, so the data I've pulled is as of today's date. There are a few slides that were published last week as part of the Berkshire weekly briefing, where the data is only up until the previous week, but I'll make it clear which data is relating to which dates. So as up until the 6th of January, there had been 4,296 confirmed cases within Bracknell Forest. Between the 25th and 31st of December, there had been 961 new cases, and that made up 22% of all Bracknell Forest cases across the whole pandemic. So you can see that the recent peak is really driving forward our number of cases that we've seen right the way across the whole pandemic since March. The good news is the current weekly rate is 698.5 per 100,000 population, which is 12% lower than the week before. However, whilst the rate is reducing, it's reducing very slowly. And when we compare it to 2 weeks previous, it's still a 19% increase. So it's still higher than it was 2 weeks ago, but it is on the way down. What I do have to say is that the number of tests over the Christmas period did reduce quite significantly. That was the same right across the country, with a lot of people getting tested up to sort of the 20th of December, but then choosing not to get tested over the Christmas period. And therefore, it may well be that this reduction that we are seeing at the moment is partly down to that. So we need to continue to monitor the rate. Expectation is that after this initial dip, it will continue to increase. The number of tests have, however, since the Christmas period increased, and we've had 515.5 tests per 100,000 over the past week undertaken, of which 21.1% of those was positive. That was a reduction on the previous week, and therefore, again, something for us to keep an eye as to whether that is an ongoing trend or whether it's a blip due to previous testing numbers. The rates in the over 60 population has also seen a reduction of 8% this last week, but is still at 500 cases per 100,000. So still a significant number of our vulnerable population have experienced COVID in the last week. When we compare ourselves across the rest of Berkshire, I'll come on to some graphs that show it a bit more clearly. It does bring our rate down underneath Slough and also now beneath Reading as well, but still above the other 4 boroughs across Berkshire. And it does bring us just above the southeast average also. So you can see a little bit more clearly from these diagrams. The Bracknell Forest is the top left graph and the rate is in blue, and you can see this reduction that's occurring here, bringing us more in line with the southeast average. As you can also see, there's been a reduction nationally and across the southeast, and when we look across West Berkshire, Windsor and Maidenhead, Reading, Slough, Wokingham, everybody has seen this reduction. It's just Bracknell's has been bigger than others. So as I've stated, it is likely that this is a result of the reduction in tests, but something that we will keep an eye on and see where that goes in the coming weeks. And I just wanted to pull this out just so you could see it a little bit more clearly. This is Bracknell's own graph that's taken from the previous slide. So I've presented this just to demonstrate, really, it doesn't provide much insight, but that in terms of the increasing rate, it's right across the geography. Berkshire is outlined in the red, but in terms of our neighbouring counties, so Surrey and Hampshire, Bucks and Oxfordshire, it's right across the patch. What we have requested of the Public Health Intelligence team is that they look to revise the scaling so that we can start to differentiate a little bit more across the patch, and they are going to do that ready for next week. But in terms of our communication lines, it's everywhere. And that's the same across the wards in Bracknell Forest as well. We have drilled down to the wards and have looked at those, both the numbers and the rates in the week up until the 31st of December. And we've compared that as well to the total cases and total rates right across the pandemic. So there are a few wards that we've been looking at that have consistently been have a high rate across the past few weeks, namely Binfield and Warfield and Great Hollands North as well. Those rates have been consistently higher than the borough's average and on an upward trajectory. We're continually monitoring those, and at the moment they don't seem to be going any further than the borough's average. So something that when we do see these numbers that spike, we do look into them in a little bit more detail to see if there's any trends that we need to monitor, but nothing's coming out at the moment. As the previous map has shown, general community transmission is right across the borough. In terms of our hospital activity, again, I've included these slides. These slides are available on the Berkshire dashboard. It's demonstrating the picture that's being seen right across the country. This is for Frimley Health NHS Foundation Trust, and the next slide looks at Royal Berkshire NHS Foundation Trust. We can see from the top graph, this is the number of patients being admitted into hospital with COVID-19, and a steady upward trajectory is being seen. and then the number of individuals in hospital with COVID-19, and again a steady increase, which is also the case for the Royal Berkshire as well. And as Fiona Slethyn-Brown communicated at the last LOEB, Frimley have their escalation plans in place now, and the pressure is continuing to increase on the NHS. When we look at our deaths, up until the 25th of December, there were initial 2 additional deaths in the borough, unfortunately, as a result of COVID-19. And this week, the data hasn't been updated, but the Public Health Intelligence team have informed me there have been a further 6 deaths, and this is going to be the increasing trend. With the increase in number of cases, there will be increase in hospitalizations, and unfortunately there will be increase in deaths. As you can see, when we compare ourselves to the average, which is the green line over the past 5 years of all-cause mortality across the borough, we've been sort of bobbing up and down, but we are now quite considerably higher than what the average of the past 5 years was, and this lower confidence interval level, so anything beneath or above that we'd be particularly concerned about as that shifts. So it's just something for us to bear in mind, that will continue. As you can see in wave 1, when that's above the average, we would say that that's a significant increase in mortality, and we're edging up to being above that line there as well. So I'll pause there. That's just again to reiterate where the data can be sourced. It's regularly updated in terms of cases and deaths, and there's a whole wealth of information on that website in terms of lockdown and other local restrictions that are in place. So please refer to that website. Thank you.
Thanks, Charlotte, for the usual excellent update. And I encourage anyone that wants to know the data that's published on the website as well, that link that Charlotte's just put up is an exceptionally good source for you, and that Bracknell Forest Council publishes our numbers on the bottom of the homepage of the website, so it's an easy place to find information. Does anyone have any questions for Charlotte? No? Excellent. Thank you very much indeed, Charlotte. We shall move on for communications updates. Communications and engagement update for national and local. Elena, this is in your hand today?
Yep, thank you very much, Chair. Just bear with me 2 seconds while I share my screen. Can everybody see that?
Yes.
Yep.
Perfect, thanks. So I'm just going to keep this very brief because we actually haven't progressed that much more since the last board. But what we have had is quite a significant shift in terms of the messaging, which has come down from national government because we are in national lockdown now. So from the announcement last Monday, we have been changing all of our assets to match the stay-at-home messaging. And we've continued that across all of our sort of multi-channels, both online and offline. So we've incorporated those messages. We've continued to use the instructional rather than the fluffy language, which the board was very keen on. And we've also recommissioned our heart radio advert, which some of you may have heard. We've done that in addition to the other communications channels because we wanted to make sure that there was a spread of messages going out across the borough. As well as that, we have been doing some quite robust communications planning over the past couple of weeks, specifically for around testing and vaccinations, and that is in conjunction with our partners. We're also still looking quite significantly for case studies because we want our communications to be quite human, because we know that resonates quite well with the audience. We think we may have a couple coming through the pipeline, but again, the plea is there that if anybody across the board knows anybody who'd be willing to share their stories, please do get in contact with us. The other thing that we've concentrated on, we know that the spread is across the borough, but we do know that looking at the sort of under 30s rate, that there is still issues there, and trying to reach those people and trying to get into their psyche and use messages that they understand and that they use has always been quite challenging for us. So we are trying to plan for that as well. What we have done over the past couple of weeks is increased our paid for advertising across digital. So we know young people primarily use social media to communicate and get messages. So we've started geo-targeting people of around 5k radius of the centre of Bracknell. But we've also made sure that, as well as that targeting, we've targeted specifically 13 to 30-year-olds. We've recently done a campaign, we've started a campaign using the assets that Public Health Berkshire created at the tail end of last year, which were audience tested with young people, and we've started geo-targeting, but also targeting it through that age demographic as well. Recent figures have suggested that we're reaching roughly around 1,700 people with each of those posts, and the majority of them are in the under 24 category, which is quite significant for our social media. So that's something that is continuing to work quite well, and we will look to continue in the future. Just moving on. Apologies, my screen's frozen. Can you see that?
Yep.
Yes.
So upcoming communications, we are looking at doing an all household booklet. The messages will include stay at home, some welfare and mental health advice, as well as physical health advice on how to keep well during the lockdown, and information on vaccinations as well. That will complement the shielding guidance and leaflet email that was sent out at the tail end of last week, and that's due to go out to all households next week. We're really trying to take advantage of the sort of 6-week period where we know we're going to be in restriction, so that we can get that information out as quickly as possible in a printed format to our residents, just because we know that the goalposts have changed quite quickly previously. So actually having this 6-week window is a luxury that we haven't had before, but it means we can get the information out quite quickly to our residents and ensure that every household has that information. Other things that we're looking at is outdoor media. So we have booked in some advertisement bikes. They are what they say on the tin. They have pedal bikes, and they have an advertisement board on the back, and they can roam around the borough, so we can target those at hotspots across the borough. So things like parks, countryside areas, high streets, shopping areas. We're looking to target those over the next 3 to 4 weekends with the advertisement bikes. And we're also looking to introduce an advertisement tuk-tuk, which is like a little van that roams the borough, and that will be from the start of February, to just spread that message in a way that we haven't been able to do beforehand. And it's a little bit quirky, so hopefully it will catch people's eye and make them take the messages on board and actually go home if they're not supposed to be out. In terms of young people communications, we've just held a Pan Berkshire focus group. We held that earlier this week, so we're just working through what ideas there we can progress. And we're hopefully working with 2 influencers to see how we can promote those key messages, including younger audiences online as well. And the other thing that we're looking at over the next couple of weeks is the better use of data. So we know, as Charlotte has presented earlier on, we've got a wealth of information in our weekly reports. Just how do we get that out to our public that is in a meaningful and impactful way, and to use that as far-reaching as possible. So getting out to our wider networks, including staff and community information champions. And one of the ways that we're potentially looking at getting that out in a more human way is by using a vlog by Charlotte herself in the next couple of weeks, but that is just some ongoing work that we're looking into. I'm just going to pause there and see if there's any questions on that one.
Great. Thanks, Lena. Does any colleague have a question? No?
Mark, it's Gareth here. Can you hear me?
Sorry, Gareth. I having the usual on Zoom. Can't
No, not to worry.
Go ahead.
There's a lot of speculation at the moment that the government is going to tighten up the messaging around enforcement, and so further amplifying, the core messages of this. It's a tricky area, as we clearly don't have a role in taking that enforcement action. Is there any plan to sort of co-produce or co-message with the police about that sort of tolerance around some of this being removed? Because the sense I'm picking up is that the carrot approach does not appear to be working in the way that many people think, and that actually enforcement, or the threat and risk of enforcement, is coming to the fore. And I say that against the background, we recognise that our colleagues in the police are working flat out, assisting the NHS, doing everything else they can do. But just wonder what consideration we've given to that.
Yeah, so we haven't touched base with Thames Valley Police on that specific point at the moment, but if the board feel that that's something that you'd like us to pick up, we certainly can. However, we are looking at how we can use the COVID ambassadors along with the advertisement bike to see if they can provide information and support and guidance. But if you feel that it's something we need to look into with Thames Valley Police, we can take that away.
I mean, I guess, Chair, the reason I raise it is because that seems to be the way the narrative is moving. I think Cressida Dick earlier on today, indicated quite publicly, if press reports to be believed, that they were going to take a less, tolerant approach and essentially do a lot more finding at first defence type contact, things like that. So I don't know if there's some mileage, because I think we all have to agree that compliance has been a little more patchy. That might actually help drive this down. And given some of the good data we saw at the start of this, well, not good, well, given the, what seems to be a slightly less terrible, but nonetheless very bad situation at the start, anything we can do to further drive that down, I would have thought would be helpful. But, I'm absolutely not criticising the response to the police. I'm just thinking if we can reinforce and support each other's messaging, I guess that would be my starting point.
I guess my only, does it dilute or strengthen the message or weaken the message by partnering with the police? Does the police get more, does it have a heavier landing if it's a joint message, if it's just the police? I'm entirely, again, I'm absolutely not being critical of the police response, but there's ambiguity about it. I'm open for comments from anybody on the call about what
if I can come back, Mark, the reason I raise it is that the sort of the rule book around a lot of the lockdown, rules and guidance is actually quite unambiguous now, quite clear.
Yes.
It's being tested and clarified all the time. So I'm just wondering where the gap is, because we don't want to clearly put any further additional pressures and obligations on our partners, including the police.
Yes.
But at the same time, if there is anything they feel that we can do that will further help the situation, by improving compliance, then I'm of the view that it should be explored. But that's a very much personal view. But it seems, you've got Priti Patel, who's apparently going to be doing the 5 p.m. briefing this evening, with messaging very much on that line. So it's just whether there's any mileage locally to reinforce what we're all doing. That was all, because I think the majority of people would welcome sort of attempts to crack down. So I welcome the fact that the supermarket said that they're going to ban people for not wearing face masks. How enforceable that is, of course, is a matter of conjecture. But overall, it's just that sense. Is this the time to work together? But that's just a thought. I'm
Kelly, do you want to come in?
Yeah, thanks, Chair. Just to say, with in response to that, Councillor, we've just had our IMT incident management team meeting prior to this, and one of the things that we discussed and the actions that we agreed was focusing specifically on how we can work as a local authority in partnership with both our colleagues in environmental health in the Public Protection Partnership and also within Thames Valley Police. So we are thinking not just from a comms and engagement point of view, but more broadly in terms of our response to COVID, how we can address that collectively as a partnership as well as just a single agency.
Thank you.
Great. Any more questions? No. Okay. I shall move on to public participation. And I believe that we actually have a question that's been submitted by a member of the public.
Chair, a question has been submitted to the committee Dropbox. The question is, has the council considered making representations to central government concerning making vaccination for staff in special and nursery schools a higher priority? Although the risk of transmission is considered to be low, it may assist in enhancing staff's well-being and confidence to undertake their important work. Thank you.
Great. And I think, Charlotte, you're going to be answering that one.
Yeah, so this has been considered and discussed. With nurseries and special schools remaining open, it is agreed that staff are at risk of transmission, having to go out to work and not being able to stay at home. And at the moment, prioritisation process for staff, health and social care staff to receive the vaccine is currently underway. So that is something that we are having those discussions and considerations around currently.
Great. Thank you. Is there any other questions that have been submitted?
No, Chair, no other questions have been submitted to the committee Dropbox that I'm aware of.
Thank you. Moving on to agenda item 7, which is to review by exception the action log from the Local Outbreak Engagement Board. We've got one that was missing from the meeting of the 23rd of December, just because of the way the timings work. And it's broadly to ask all board members to notify, I guess through Elena initially, of any false or inaccurate information that's circulating in the general public domain, so that we can be aware and counter some of those negative messages or incorrect information that's coming out. Is there anything else that we need to add on that bullet point? I think we've got still a request, if anyone is aware of anyone that would be willing to become a case study. I think to Elena's earlier point, that would be a very powerful thing for us to actually be able to use. And then the third point, sorry, was just Kelly, to inquire public health shared team if the data that was on slide 10 shows the number of deaths in Bracknell that relate to COVID-19 could be replicated for Slough as a comparison.
Yes, I think we have. Yeah, so that was a question that was raised a few meetings ago. I think we have confirmed previously that the information that we were sharing, we didn't have access to the exact same information for the Borough of Slough. However, the Berkshire Public Health website, which both yourself and Charlotte have referred to earlier, does have comprehensive information which will cover the Borough of Slough as well as our own.
Great, so that's resolved then. Brilliant. Finally, if there's nothing else to discuss for this meeting, that the next board meeting is scheduled for 4 p.m. on Tuesday, the 2nd of February. And if there's nothing else, I will declare this meeting closed and ask a democratic service to stop the broadcast.
Chairman, I was just going to advise, I understand an additional meeting has been slotted in for next Tuesday.
I apologize. Do you know, yes. So yes. So next Tuesday, and the details will be circulated. Sorry, it's just my diary's updated. So yes, next Tuesday at 4 o'clock.
Yes, Chair.
Brilliant. Sorry for that confusion. So next meeting is next Tuesday at 4 o'clock, and then following meetings from there. And in which case, I can now declare the meeting closed.